Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
All right, guys. Today we're talking about two diseases that are pretty rare in pregnancy, but if you get them and pass them on to your baby, they can be devastating. So we just want to chat around them. Now, we know that there are a lot of what seem like rules and regulations around what we are allowed to eat and not eat in pregnancy. And today's podcast is focused on that. Hopefully, you'll have a better sense of why we recommend these things. And we also understand that these guidelines may be a bit stringent in some people's views, and that's fine. But the outcomes, if you do get sick from these two infections, can be devastating. And so that's why you'll often think that your care providers may be a little bit over-inclusive in their recommendations for you. But why don't we get into it? So today we're talking about toxoplasmosis and listeriosis.
So, first things first, let's talk about toxoplasmosis. So, toxoplasmosis is a disease caused by the intracellular protozoan parasite Toxoplasma gondii. So, most immunocompetent individuals, so that means most of us who are healthy and have a fully functional immune system, we're not on any medications that suppress our immune system, or we don't have any diseases that impact our immune system.
Like pregnancy.
So pregnancy does impact your immune system, is what Alicia's saying here. So if you're fully immunocompetent, if you contract this parasite, you actually wouldn't really develop any symptoms. Or you might experience what we call sort of non-specific, so general flu-like symptoms. That could be a mild fever, headache, some muscle pain, and swollen lymph nodes. What is really important to understand is when toxoplasmosis is acquired for the first time in pregnancy, this parasite can actually be transmitted across the placenta to the fetus. And this results in something called congenital toxoplasmosis. Congenital means basically acquired while in the womb. And this can really, unfortunately, have grave consequences. So in humans, the main way we would get exposed to this parasite includes eating raw or undercooked meats, drinking unpasteurized milk, or contact with cat litter, sand, or soil that has been exposed to the feces of specific cats.
So infection with Toxoplasmosis gondii before pregnancy usually doesn't pose any risk to the fetus, except if you contracted it within 3 months of getting pregnant. So if you contract it and then 6 weeks later you get pregnant, then there are some concerns. If you do get it early in pregnancy and you pass it on to your baby, some of the things that can happen with your baby in congenital toxoplasmosis might include hydrocephalus or fluid around the brain, microcephaly or a small head, brain and eye abnormalities, including blindness, physical or developmental delays, low platelets, and anemia. While infection in early pregnancy poses a small risk of fetal transmission, so only 6% of people who get the primary or the first-time infection in pregnancy will pass it on to their baby, those babies can be very severely affected. If you get it in the third trimester for the first time ever, you have a much higher chance of passing it on to your baby, between 60 and 80%. But if you get it in later pregnancy, it's much less dangerous to the fetus in terms of those severe outcomes. However, babies born, even if they've been affected in the third trimester, can go on to develop brain or eye issues in childhood or even in early adulthood. There is no evidence, though, of Toxoplasmosis gondii being transmitted through breast milk or from direct human-to-human contact. So it's generally you're exposing yourself to the eggs which are laid in the cat's poo because the toxoplasmosis, their way of reproducing, happens within the cat.
what do you do if you suspect toxoplasmosis exposure in pregnancy? And so, what we do as care providers is first we need to know if this is the first time that you've been exposed, the pregnant person's been exposed, or if they've been exposed in the past. And if they've had past exposure, it is much less riskier to the baby. We also need to know if this is the pregnant person's first infection. Do we think the baby has been infected? And this can be done by testing the amniotic fluid. Now, if we think the pregnancy has been affected by the first incidence of toxoplasmosis infection, we would, obviously with the guidance of our obstetrical specialists and infectious disease colleagues, start antibiotics to try to prevent the baby from becoming affected by the infection, and we would closely monitor the fetus as they grew.
So you may be thinking, oh my gosh, how do we not get this? This sounds really not ideal. And it's right. And again, you'll notice some of the reasons that why we say what we say. So prevention of congenital toxoplasmosis is really dependent on avoiding getting infected during pregnancy. So this involves avoiding litter boxes or soil owing to the presence of those kind of the toxoplasmosis little eggs that are shed in the cat's feces. Cats that are likely to be a source of infection, more likely so if they're outdoor cats. So if you have an indoor cat, it's much less risky. And then feeding your cats only cooked, preserved, or dry food. So no wet food and no raw food. That increases the risk of them having toxoplasmosis and shedding it. Yeah, it's also important for you, not your cat, no, but both, to avoid undercooked, raw, or cured meat and raw, unwashed fruits or vegetables. And also proper hand hygiene is essential after touching cats or being in the dirt or changing kitty litter or playing in the sand with your toddler where a cat may have had a poop.
So we do this preventatively because we know the potential can be devastating. I have to say, in my experience, I have not had any pregnant patients with toxoplasmosis. Have you?
No, I haven't.
No.
And I actually had one patient who was from Italy, I do believe, and had eaten a lot of cured meats,
meat,
and she
yeah.
really loved cured meat. So we actually did some testing in her early pregnancy to see if she'd already been exposed to toxoplasmosis so she could continue on eating cured meats in pregnancy because it was a huge part of her culture
Yeah.
and very important to her. And she had. And so she went on safely doing that. Just a little segue.
Yeah.
If you guys like our podcasts and you want us to keep doing them, we love to hear from you guys around ideas or podcasts that have been especially impactful. So make sure you shoot us an email at shefoundhealth@gmail.com or send us a DM if there's a certain topic that you want covered or if there's been some really good podcasts. And if you're listening to this podcast right now, feel free to take a screenshot and post it to your own social media and spread the word around it, guys.
Please do.
Hey, Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood prenatal masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the 4th trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the 4th trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the 4th trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
So moving on, we've talked about toxoplasmosis and its rare but potentially devastating outcomes. Now we're going to talk about another less rare, more common, in other words, more common infection, and that's listeriosis in pregnancy. So Listeria is a bacteria, not a parasite, a bacteria that can cause a foodborne illness called listeriosis. So it's an illness that you contract by eating food that's infected by the bacteria. So Listeria can be found in soil, water, cattle, and poultry. So basically everything we eat. And so understandably, it's one of the most common sources of food poisoning.
So listeriosis, the disease you get from Listeria, can cause mild flu-like symptoms such as fevers, chills, muscle aches, and diarrhea or upset stomach. Sound familiar? Like toxoplasmosis.
Mm-hmm.
But you can also have a stiff neck, headache, confusion, or loss of balance. And this is the crazy thing. Symptoms may appear as late as 2 months after you've eaten something with Listeria. So many pregnant people don't actually have any symptoms. And even if you do not feel sick, you can pass the infection on to your fetus, which is frightening. We also know that pregnant people are 10 times more likely to get listeriosis than the general population. Vomiting and diarrhea can also cause the body to lose a lot of water, and this is called dehydration. And then listeriosis can also, in and of itself, cause miscarriage, stillbirth, or preterm labor.
Wondering about the impact of listeriosis on the newborn or the baby. And it's important to understand that if exposed to Listeria, the baby can be born with severe infections, and this infection can be present in the baby's blood or in the brain. And listeriosis, so that infection caused by Listeria, can actually cause lifelong health problems for your baby, including intellectual disability, paralysis, seizures, blindness, or problems with the brain, kidneys, or heart. And unfortunately, it can also cause death in newborns. Now, this is very rare and it is treatable, but it's just important to understand why we make the recommendations that we do.
So if we think that you have listeriosis, the first thing we do is to take your blood work to check for the disease. And if it comes back that it looks like you do have listeriosis, we would start antibiotics to help you and help prevent either you passing it on to your fetus or the outcomes in the fetus. So let's talk a little bit about how can you prevent getting listeriosis.
So to help prevent getting listeriosis and other bacterial infection, generally we recommend, again, avoiding the following foods while you're pregnant. This includes unpasteurized milk and foods made with unpasteurized milk. This includes, unfortunately, many soft cheeses. Hot dogs, my kids would be devastated, and luncheon meat, unless they're heated until steaming just before serving. Refrigerated pate and meat spreads, refrigerated smoked seafood, and unwashed raw produce such as fruits and vegetables.
We also recommend avoiding all raw and undercooked seafood, eggs, meat, and poultry while you're pregnant. Frankly, you should probably avoid undercooked poultry all the time.
Oh, God, that's gross.
We also say not to eat any sushi made with raw fish. Cooked sushi is totally safe. And that cooking and pasteurization are truly the only ways to kill Listeria.
Now, it's important to understand that, again, if you feel unwell and you get assessed early, that, again, we can treat with antibiotics. And ultimately, in the grand scheme of things, we do typically catch things early enough, but the potential consequences can be really devastating. So it's just important to have this information and be empowered with the knowledge so that you take the steps to prepare and protect yourself, remembering that you always have autonomy as a pregnant person, and pregnancy is a
very short window in your overall life.
Yeah.
So I think the take-home messages are these are very rare diseases and quite preventable. So washing all of your fruits, vegetables, cooking your meats and fish and eggs properly, avoiding unpasteurized dairy or unpasteurized dairy products, and getting somebody else to clean the kitty litter.
Yeah.
And washing your hands.
Yeah. Wash your hands. Wash your hands.
What's the happy birthday song? 20 seconds?
Oh, yeah. You have to sing it twice.
Oh, gosh. 40 seconds.
I know. I've heard.
Washing.
I know. I didn't realize that.
Make sure you moisturize after you wash your hands or else you'll get eczema.
So hopefully you found that helpful. And as always, if you have any questions, comments, concerns, or other topics that you want us to include in our podcast, please reach out to us.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.